All right, good afternoon or good morning, depending where you are in the world these days. Thank you so much for joining us for Navigating a Changing Landscape, a mobile healthcare community discussion. We're so glad to have you with us. My name is Elizabeth Wallace, Executive Director of Mobile Healthcare Association, and we are proud to co-present this discussion with the Mobile Health Map from Harvard University. We want to thank the generous support of the Leon Lowenstein Foundation, who has had a vision of advancing mobile health care for the last 5 years and has been a wonderful partner with both the Mobile Health Map and Mobile Health Care Association. Next slide. Just want to go over a couple of ground rules for our community discussion. All participants were muted. There may be a time at the end where we'll ask you to unmute and contribute, but the chat will be open. Please be an active listener and be respectful. We know we all have different opinions about what is happening in our world today, but we're looking for solutions here. And there will be polls throughout. This has actually changed. The polls are going to be a traditional poll, so you'll just answer like you're used to on all Zoom polls that have been going on the last 5 years. So thank you so much. We are here to learn from each other, to understand that this is a time in our country where we do need solutions, and we are excited to be here together in community to share. And now I'll pass it over to Dr. Nancy Oriole.
So hello, I'm Dr. Nancy Oriole. I'm your co-host from Mobile Health Map. And 33 years ago, when I was an anesthesiologist, I founded the Family Band. Then 15 years ago, when I was Dean for Students at Harvard Medical School, working with Jennifer Bennett, who was the executive director of the Family Band, and Anthony Bavasas from the Mobile Healthcare Association, we created Mobile Health Map and the Return on Investment Calculator. So I'm here representing my brainchild, the MAP, and I'm going to share some context and history about this webinar. So you all know we are in the midst of uncertainty and change. The last time we were in this predicament as a sector, as a country, as a world was March of 2020. At that time, the association and the MAP were listening to you. We were hearing about your problems, ideas, and solutions, so we pulled you together on Zoom to share directly with each other. We held three webinars in March, April, and May of 2020, and you told us through stories and polls what you were seeing and what you were doing, and you shared best practices. The take-home messages from those webinars was that mobile clinics are adaptable, flexible, and trusted by the community. So we took the data from your polls, from those polls, and our message about us being trusted to the White House Task Force on COVID, and the concept took hold that trusted messengers were a necessary part of the response to the pandemic. And in many cities, mobile clinics played a vital role in how health education, testing, and vaccines were rolled out. Now, if you heard my TEDx talk on mobile clinics and prevention, that's a serious plug, okay? You heard the story of Dr. Phil Levy in Detroit, who pivoted his mobile clinic from a COVID response program to one that finds and manages chronic disease. And in doing so, he had such success that he was able to partner with insurance companies and create innovative payment methods for his mobile program. For him, COVID was an inflection point. We are now at a new inflection point, not of the uncertainty of a pandemic. This is a time of financial and regulatory uncertainty. So let's do it again. Let's come together, share what we're seeing and doing. We want to meet this moment like we did before, so the MAP and the association have brought you together again. Let's talk about what we can do to help us all navigate this changing terrain. What needs to be in place to help prepare us? We know we are flexible and adaptable. How should we use those strengths now? And this webinar is just the beginning. We're here to learn and together figure out what we can do. And I now turn it to Elizabeth to take you through some stories and pick your brains. We drive into people's communities, and as such, we become part of the fabric of their lives. We see things that need to be done. Let's share our knowledge, even if at this point, all we have is questions. Thank you, Elizabeth. Take it away.
Thank you, Dr. Oriole. That is so well said. I think sometimes we are so overwhelmed by not having all the answers I know myself, sometimes we say we let great get in the way of good. And so we know at this time that I feel like every week something is changing around regulations, financing, grant opportunities, what our patients and your patients are having to deal with. And so we're here really today to talk, to learn from each other, but also for us to prepare as we move forward with what resources and solutions the association and the MAP can provide all of you as we navigate in these uncertain times. So with that, we're actually going to launch a poll right away to kind of get a pulse on where everyone is thinking. And what I've been hearing is that people are seeing a decrease in their patient populations showing up, whether you're appointment driven or not appointment driven. And so we are trying to understand if you all are seeing that. So if we could launch that first poll to see if you experienced since the start of 2025 a change in your numbers at your service sites. We'll just give that just a minute or two. So excited to see well over 100 people joining us today. I think it's really interesting to know that I think it really depends on your community. As we know, all mobile programs are unique, right? And so the challenges you're facing, we know are unique in some ways, but I think some of you are going to be surprised by the results of this poll. I think we can go ahead and end the poll and share the results. All right there. So we have about 20% of the programs who are seeing more people, which is so wonderful to hear that you have the capacity to do that and that people are coming to you as trusted messengers in the community. Um, the numbers are varying depending on the site, I think is probably true before this time, this moment in time, and also um, nuanced based on your patient population. And only 12% are saying that they're have across the board seen fewer patients. And so I think that's going to allow us to kind of understand that there's not one size fit all to any of these solutions, right? But I'd like to ask Mary Catherine from the Family Van to share with us a little bit. She's shared with me that they have seen a decrease in their normal sites, and so what they're doing to address that. And Mary Catherine?
Thank you. I couldn't find my mute button. 5 years later, I still can't find it. Thank you, Elizabeth. It's great to see so many people here today coming together. And I am Mary Catherine Fallon. I work with the Family Van, which is a mobile clinic right here in Boston. And I also work with Dr. Nancy Oriel on Mobile Health Map. So I know many of you, but for those of you that don't know about the Family Van, we are a prevention health van that provides free health screenings in Boston. We've been doing it for 33 years, and it's a trusted, safe location for community members. We bring essential health care like many of you do, and our program is walk on, no appointment needed, no insurance needed. Everybody is welcome, no matter who they are or where they come from. So we've been noticing a decrease in foot traffic around the neighborhoods. And like I said, we are no appointment based and walk on model. And we noticed that people weren't leaving their homes unless they needed to. So we said, okay, we know there's still a need. How can we address this need? And how can we still reach our community, even though people aren't maybe out and about as much as they have been in the past? So we did two things. One, we continue to travel to the same trusted locations every day. Seeing our van as a steadfast presence gives people the comfort and reinforces that we are there for them. And we're a consistent part of the community. People can count on us. And people still come by the van. We have many repeat visitors that come every day, every week. So our van is still out in the community. But we did something else. The second thing we did was we added a second location at the same time in the same community in a community space. For example, while we're continuing to provide the trusted services on our van that we're so well known for, we send a few staff and volunteers to a community space where they've been setting up a table. we're bringing the family van to places that people go to in their daily lives, like the supermarket, the food pantry, a community center, the local library, and the consulates, places where people are already getting food, resources, support services. So we're removing one more barrier and letting people get screenings when they're out doing their errands. It means people can get a blood pressure check, learn about our mental health program, learn about medication management, or even receive a referral while they're picking up their groceries. So that's one thing that has been successful for us. And in fact, I just pulled the numbers since we've started doing this, and we're up 14% over last year for our visits. So we started out a little lower, and by by expanding our services from the van, the trusted space of the van, into the community, we've increased our numbers. So, but it's also done more than that. It's actually increased our relationship with the community settings. The supermarket, they love us. They're always talking about the family van. The consulates, the library loves us. So they're always talking about when we're going to be there next. So it's done two things. It's helped us increase our numbers and also strengthen the community as a whole and the connections in the community. So if you think you don't have the bandwidth to do both, I would say volunteers are the secret sauce. You don't need to have all of your staff members in both places. And if you do provide a specialized service, you can still have a table in one of these community settings with a volunteer that can help refer people back to the van and say the van is still there. So those are just two things that we've been doing that have been pretty successful.
Thank you so much, Mary Catherine. The Family Van has been a leader in this space for a very long time, and proud to have you be a part of our association as well. I'm seeing in the chat some interesting comments that are not surprising, but where one program is seeing that seeing an increase significantly in rural areas where hospitals and clinics have closed, but that they also see a Latino population who has fear, and they've seen a significant reduction in patient populations. And we're seeing a couple of different comments around the Latino community and their fear and how that is going to be addressed. And I know with mobile health being trusted members of the community, we're now that we're in this crisis, we're hoping that we will work together with some solutions of how that trust that you've already built can be used, and also understanding of what the rights are of those patients in your program. We're going to launch another poll that's still talking about sort of patient engagement in this time of uncertainty. I'm going to launch that poll. And this is kind of understanding what kind of strategies might you be implementing to support or grow participation in your program from a patient population or community partners. And I think the interesting thing around this is we know that all of these things are moving targets, right? That the solution that we might think works today may or may not work tomorrow. But what I love about mobile health is that we are always adapting and flexible and thinking about what those solutions may be. So we're going to end the poll. And my understanding is that you could vote for more than one, I believe. So we're seeing obviously a lot of what Mary Catherine just talked about, expanding outreach into community partnerships. But it's interesting to see that people are adjusting their scheduling and locations, and also looking to add new services or resources. Because we also know that financial limitations sometimes make that very challenging in the best of circumstances, and often we are not in the best of circumstances right now. So I'm going to ask Ashley Greeley from Caring for Miami, way down south. I think they had some storms yesterday, so I hope you all are okay. And what they're doing with their program, their wonderful dental program, to kind of address what they are seeing with variations with patients.
Thank you, Elizabeth. Yes, we still have storms. So if I cut out, it's our internet that's a little spotty today. So at Caring for Miami, we started about 15 years ago with a mobile dental clinic, and we've been serving the community here in Miami for the past 15 years. And since then, we've expanded to include an additional mobile unit. We recently updated our mobile dental clinic to a brand new unit. And we expanded our services and our outreach models to include a mobile food market. So we knew that the city was changing. There was a lot of gentrification happening. There was a lot of fear within our migrant populations and the families that we serve, and people were being displaced. So we really had to rethink how, when, and where we operate as a clinic. And in response to that, what we did was we extended our clinic days and hours. We sought out funding and support from sponsors to be able to add additional days, to be able to serve people who were predominantly working during the hours that we were serving, so that we could see more patients. And that has helped. We've seen about a 30% increase in our patient population. We really looked at deepening our partnerships as well with our local site, like our site hosts, churches, schools, and other clinics as well, brick and mortar clinics that could refer patients to our dental clinic. And we do rely heavily on these site partners to refer patients to us, because we know that they're the ones in the community that have the trust that we're trying to build with the patients that we're serving. And so we had to rethink several of our sites in order to better fit the needs of our community. And so we had a small team, and we do have a small team here, but we do rely heavily on volunteer dentists and hygienists throughout the to make this possible. So definitely expanding our volunteer program and investing in being able to go out and market who we are and what we provide and how dentists in our community can get involved. And one of the best successes that we had with that specifically was through our local churches, where there's just a built-in DNA of people wanting to serve and give back. So this past year, we also added in this mobile food market, which is an expansion of our services. It wasn't dental, but we definitely do see that correlation between dental health and food insecurity. So we knew that it was something that we wanted to implement in our programming, and that has helped us increase not only the number of patients that we're able to serve, but the communities that are opening their doors and allowing us to come in, because we are changing our mobile clinics to adapt to the needs of our community. And this, Kim, I was sharing with Kim briefly, but this year we're also introducing a mobile closet to help care with the needs of clothing and shopping and bringing dignity back to these families that we serve. And it's breaking down barriers that are then allowing us to serve their health needs, because that's probably not the first way that we're going to grab them. And a lot of the patients that we serve, about 70% of them, they're not going anywhere for their care. They're not going to the hospital. They're not going to other clinics. We've surveyed them. They're just not going anywhere. They're waiting until it's an emergency or until they really need to come see us. And so the way that we're able to sort of gain their trust and get them to come on out is through providing other services that they really do need week to week.
Thank you so much, Ashley. And it's so reaffirming to see that you're looking at those social determinants of health and how you can meet those needs first in order to then meet their additional health needs. So thank you so much for sharing. I see Monica Townsend from Rutgers University in the chat added a really interesting idea. They've added a lunch and learn component to introduce their program to community members and organizations in advance of bringing the van out, in hopes that it will increase registration. So we'd love to hear, Monica, how that continues to grow and if that does work. But it also, she says, they're using it as a learning opportunity to really understand the challenges that are happening in the community, which is something that we know is so very important. And then I see Penny has added that they've added a bilingual community health worker to their team to assist their migrant families maneuver the healthcare options due to their fears and barriers. We know that community health workers can do so many things and wear so many hats, just like all of us in mobile health. And so it's nice to hear that is working for them. And then Marie Verna has put in the chat that they're partnering with jails and prisons to reach people who are being released and often have no health care. I know there's a program at St. Louis University that's doing something similar. And getting them into care right after they've been released is such a vital time to get that population. So now I think we're going to pivot a little bit, but feel free to continue to put into the chat any ideas that you are doing on expanding your community partnerships or how you are working with your decrease or increase of patient populations that you are seeing during these last 5 months. And now we're going to talk a little bit about funding. We know that pre-pandemic funding was the number 1, 2, and 3 sustainable funding issues that we heard from mobile clinics. When the pandemic happened, then we saw that staffing, either recruiting and retaining staff, kind of became one and two with funding. But now, with so much uncertainty coming from the federal government, staffing seems to have risen back up to the top to have its own place on the podium. And so we're curious to know what kind of funding issues or wins that you are seeing during this time. And so we've got a quick little poll here to see if you have experienced a change in funding. And I'm crossing my fingers that you're all going to say it's increased. All right, I think we will change the poll. We'll close the poll here. So unfortunately, my prediction was not correct in that only 4% have seen an increase in funding. But I think seeing that the funding mix has changed is another example of how mobile clinics need to continue to be adaptable, and understanding that while maybe one type of grant might not be what you can count on right now, that we're seeing philanthropy and others step into the space, or managed care programs. And so kind of understanding that what is possible is never, the one door closes, we're going to open 11 windows, right? So I'd like to ask Jake Schwab from Jefferson County Department of Public Health to share a little bit about what they have been doing, some innovative solutions. I saw he was on here earlier.
All right, can you hear me now?
Yep, we sure can.
All right, sorry about that. I was having some microphone issues too. Yeah, so as that poll was kind of going towards, we all have to try to figure out new ways to get some funding sources, whether that's moving things around or searching for new avenues, or just maintaining that core funding that we've had in the past. So that's kind of where we're at right now. We've been working directly with state contract holders on financial needs to keep programs going. One such example would be our state contract holder for our Title X federal program that supports our family planning clinics is the Missouri Family Health Council. We've had several discussions with them, and they have a little more pull than we do as a local health department. So whenever we're trying to leverage their support with funding, such as the Missouri Foundation for Health, we've been successful at getting an extra 3 months of funding through our Title X program by using this method. We haven't historically provided family planning services out of our mobile unit in the past, but we're starting to explore this option a little bit more coming up this month, actually. Where we've partnered with Walgreens to do an HIV awareness day, part of their national campaign. Through that, we're going to a local Walgreens with our mobile unit and bringing our family planning team on board, where they're going to be offering free STI testing. Not that this really provides a whole bunch of direct funding to us, but it is another way of providing outreach and putting ourselves out there to become more visible with a new partner that we really haven't had that relationship with in the past. So new location, new types of people coming through, all can be positive. Something else we've started to do is having conversations with insurance providers such as Aetna. This is something that is really in their best interest to keep local providers going and serving patients in our area. So we're kind of working with them to complete a Missouri Strategic Partnership Grant application, which will be able to cover our mobile services as well. We are also writing for more foundation grants. Here in Jefferson County, we have the Jefferson County Foundation. We've written for a couple different programs, but one specifically is our direct client services grant. We just had gotten word that we received that one as well. So that's another $175,000 coming to us for June that we can use towards our programs and direct patient care, which we had earmarked about 80,000 of that being direct patient care. So that's going to be really critical for the patients to continue to receive these services over the next year with potential cuts to Medicaid that could be coming down the line. And really just the last thing, kind of what I was mentioning at the beginning of this, even though you got to pivot at times and kind of search for those alternate routes of funding, we find it really important to still keep that core group of your funding source coming in. So that for us is a lot of schools. We'll go there for physicals and dental care, and that's just always a tried and true method for us of a steady flow of income. So we're not looking for that wholesale change of, okay, we got to switch tactics completely. You got to keep that core and still look for alternate ways to continue that funding to grow.
Thank you so much, Jake. And congratulations on the success with your new grant. That's always wonderful to hear. And Aetna has become a partner of the association recently, so I hope that you have continued success with them as well. Jackie put a really interesting comment in the chat that I wanted to highlight, that their community outreach coordinator attends Chamber of Commerce meetings in the communities they serve. And not only is that getting the word out about what they do, but and more organizations know them, but there are also funding opportunities there, right? You never know who might be at your Chamber of Commerce meeting, your Rotary meeting. And so I thought that was a really wonderful suggestion that I wanted to highlight. And then the other thing that I wanted to highlight from the chat was someone was talking about how they're really working with community partners to have what they're calling service fairs, whether it's mobile showers, food pantries, behavioral health, and they know that they're not doing this all at the same, they're not providing all of the services, but by getting those groups together, that they're able to see the effective. And I saw that comment come from a couple different people about, Tom mentioned that in the chat as well as Rochelle. And so I want to thank you for that information as well. And I'm sorry, I was just trying to read the chat and talk all at the same time. It's a skill that I'm decent at, but need to. So I wanted to ask Nanette Bester from Southeast Community Health Systems to share a little bit about how their program has pivoted and what they've done in these new times.
Thank you, Ms. Elizabeth, for allowing me to share in this space with you. What I want to first say is I totally agree with Ms. Nancy. What she said earlier is this is a time that we have to learn to be flexible. And with these changes that's happening, we have to learn to adapt to these changes to keep things afloat. So we operate a mobile wellness coach. We are an FQHC, so we have back-end providers and from FQHC where some of the mobile units I know stand alone. So what has happening is we've had to learn to we provide both on our coach. We provide both billable and we actually provide free services on our coach as well. So our main goal on our unit had been to provide in the community different screenings that if when we realize that if we would see a patient, if they levels was high or something, we could always refer them back to one of our clinics. But what has happened now with some of the changes that we have expanded our outreach program to go deeper into some of these rural communities. And we did a community sweep. And so we were asking what was the issues preventing, some of the people to come to get service. And again, the main reason was transportation or lack of transportation for better phrase. So what we have done is we've worked because we know we needed to increase our encounters. So it's twofold for us. So when we go out now, we have partnered with some of the rural communities, and we are bringing our mobile wellness clinic and not so much focusing on the free services, but now to providing preventive care. So we began yesterday. As a matter of fact, our first site opened yesterday. So, and I think on yesterday, with it being our first site, 4 was a good number. So we were able to see 4 new patients who were not already patients because of being in the rural community. So we have 3 this week, and we have 4 set for the following week. So we have partnered with several sites on bringing our mobile unit into deeper into some of the rural areas where the patients said they don't have transportation to get to our clinic. So hey, we take the clinic to them. So I think that is going to be good for us because a lot of the people that we are seeing are Medicaid, Medicare. I know that we are looking at pending cuts to Medicaid, Medicare, but I think if we continue to do this, when we do, one of our main focuses is social determinants of health. So in one of the areas, we partnered with one of the local grocery stores who is about to close in that area. So we partnered with a this business who is providing us. So we will be setting up at that grocery store at least twice a month, and the provider is giving the community gift cards. So when they come shop on the days that we're at the clinic, they're providing each one of the people that come to get services, they will be paying for their so much percent of their groceries. So that both helps us, the patients, and the grocery store, because if that grocery store closes in that area, then it's going to be and we're already a food desert, so that would be a disaster for that area. So we're partnering with people like that to provide the services so that we can do what we can to assist in some of those rural areas and
Where
provide
did you,
care
thank you, Miss Buster. Where did you get the funding for the gift cards for the grocery?
from a philanthropist,
Wonderful.
from an
That's
area
great.
philanthropist who he does all of that. He works with the grocery store, so we just come to provide services on the day that he provides the gift cards for them to shop.
Wonderful. Thank you so much for sharing. I saw an interesting comment from Rosemary in the chat. They started a program they call Mission Meals and Medical, where they're offering a free hot meal to go along with their medical care and vouchers to their hospital thrift shop. I think that is such a wonderful idea. And then we also have someone in the chat who mentioned that they sometimes offer a free drink if they're parked outside a bar or club and they're doing HIV or STI testing. So I love that we have to understand our patient population, and a hot meal might work for some and a drink might work for another. So I love that idea. That's super fun. Nanette, there's a question in the chat that I'm hoping maybe you can address in the chat, wanting to know how you document your free services for UDS credit. So if you wouldn't mind answering that in the chat, we'd appreciate that. And now we're going to launch another poll, kind of asking your pulse on some financial and understanding if your program has experienced a change, which it looks like pretty much everyone has. How are you adapting? What are you trying to do? Or are you have not been able to adapt? All right, I think we'll end the poll. And I see that we're having a lot of people who are exploring new funding opportunities. I think that has been the case prior to and during funding, but I think that understanding what those new opportunities are, right, is a changing landscape of healthcare, and that we are seeing philanthropy step into this space. But we're also seeing opportunities to partner with hospitals or managed care programs who do not want to have people in their ED. And actually, Ashley, I'm going to ask you if you'll jump back on just for 1 second here and perhaps share with us some of the innovative funding things that you have been working on for your mobile program.
Specifically with our funding?
Yes.
Yeah, so some of the things that we've had to work on over the past 18 months, just due to the changes in grant funding and the federal funding, is really increasing how we approach individual giving and creating sponsorship packages to be equipped to better approach corporate sponsors and local businesses. So we have different sponsorship tiers for each one of our programs. And additionally, we utilize designated funding for individual donors, but we've definitely taken it up quite a few notches in our email marketing and our social media to encourage individual donors to give to the work of Caring for Miami. And so we've done that with the help of our platform, Fundraise Up, and really just being able to use systems and tools that are designed in a way that's actually psychologically leading people to be more likely to give. And so, I mean, I'm welcome to share that with anybody who wants to talk a little bit more about that off of this call, but using the tools from some of these web pages on our web page to really drive giving through social media and email marketing. And we've also really increased our in-kind donations to offset the cost of supplies that we would otherwise have to buy. And we've done so at about a 64% increase in in-kind donations in our organization, just by being able to leverage local businesses and sponsors. And this year, we actually launched 2 additional fundraising events. We just held our walk to Care for Miami. It was the first walk we ever held, and we had 700 participants who engaged and came out to walk with us. We raised about an additional $50,000. And this fall, we are going to be hosting a golf tournament. And all of this has really just helped us generate more revenue, but thinking outside of the box and how we can continue to offer entry-level participation events for people to get involved with what we're doing, which allows us to then build more consistent donor base.
Thank you so much, Ashley. We know that continuing to pivot in all ways of mobile health is not only necessary, but really allows us to kind of adapt to these changing times. And that's really exciting to hear that you're seeing success with more on the individual donation level. But I think in kind is something that we all need to think about. And I also would like to give a shout out to our partners at Direct Relief for those free and charitable clinics and FQHCs. They have, it's free to become a member of Direct Relief, a partner of theirs. And they offer a lot of supplies for free that you can order once a month. So I'd recommend looking into them as well. And now I'd like to ask Sean from Swope Health in Kansas City. I believe you have a positive story to share with us.
Can you hear me?
Yes, good. Yep.
Okay, just checking. Okay, yeah, sorry. I don't think my camera will work. So just a heads up on that. I tried it and I'm still dark. So I'm assuming it does not work. Okay, so yes, I do have a positive story. We just got a new mobile dental unit. We increased our services over the past year when everybody else was, yes, unfortunately trying to find services due to lack of providers in our area. So we sought out funding kind of on a different level. We noticed a decline in the federal funding over the past 2 years and noticed kind of an incline or upscale in the state funding, which was good. However, it would not allow us to increase, I guess you'd say, on the provider level or on the equipment level, mostly just on supplies and which was kind of funny, marketing materials, which yes, we all need, but we kind of needed other things. So we sought out funding in our community partners. We were in school systems already and working with all of those great partners. We started to notice that there were more volunteers coming out to schools, as in a church level, people helping out with churches and donating their time. We ended up getting in with one of our schools, and one of the advocates there was Church of the Resurrection. They have a great school-based program where they do food programs and ESL for schools, and they also do some other great services within different communities, I guess you'd say, around Wyandotte County and Jackson County, on both of the state lines of Kansas City, Missouri, and Kansas City, Kansas. So we started partnering with them and just kind of going to their schools. They saw what we were doing. They loved our mission, and then offered to buy us a new mobile unit. They reached out. They actually, funny story though, to add to that, they reached out and thought, oh, you already have a dental unit. How about we buy you a medical unit? And we were like, that's nice. Thank you. We would love that. However, we actually need 2 dental units because we are seeing such an increase in population. And what we had noticed that our kids were not getting the access to care and their needs met 100%. So yes, we were doing the preventative aspect of it. However, we noticed that a lot of kids were still getting on our bus and still had not gotten the restorative need met. So so we started the second bus, and that went into completion, I guess you'd say. It took about 10 months to get built from ground up, and then it just got delivered in February of this year. So we had to wait because we are a federally qualified health clinic. Change of scope, HRSA driven. Then they laid off 800 people at HRSA. So then one of our dental director at HRSA got laid off. He was one of those people. So then my application sat on his desk for 4 months, which kind of was sad. But we missed out, of course, on the end of the school year. However, we are up and running now. We got clearance as of Monday. We got the certificate back. So we are ready to roll, and we are rolling out for the summer, and super excited for the next school year.
Thank you so much, Sean. And I think, always a nice gift when somebody says, hey, can I buy you a mobile clinic? But I think 2 lessons from that. Number one is that Sean was able in her program to speak up and say, well, this is really what our community needs. Thank you for thinking what our community needs. And not just, you don't have to say yes to everyone, or at least not yes in that way. But the other thing is that we learned that, this gift of a clinic came because of the time and the resources that they put into building community partnerships and people understanding what was happening there. And I think that that's a really exciting thing to see that it worked. We like to celebrate our wins as long as also acknowledging that there are a lot of challenges that are happening right now. So now we're going to get a little fancy here, and I believe we're going to try and do a word cloud through Mentimeter. So for those of you who have not used Mentimeter before, you can either go to menti.com, or I believe a QR code, is going to pop right up on your screen. And if you want to go to menti.com, then you would enter the code. I'll put it in the chat if someone hasn't already. But we're asking you, so here's the code you would put in if you go to menti.com. But we're asking you to, and it's also right there at the top of the screen, what are your top 3 areas of opportunity for your mobile program? So that is a really positive spin on saying, what are some areas that perhaps are not thriving that you are looking for help or assistance on in your mobile program? And you can put them in one at a time. You can put them in with commas in between. I think they both will work. And as it starts to populate, Kim, are we able to see that as it happens, or do we have to share at the end?
Can everybody see the screen with the blank slate and the QR code?
Oh, here it comes. Here it comes. It's like magic. Well, I think what we're learning here is that the needs are as diverse as the communities that you serve. But also we're seeing some topics rise up to the top. Staffing, funding are the two we would expect to see here. But we're also seeing mental health, new partners, collaboration, um, and I'd also like to share in the chat. There's the email to sign up for Direct Relief to be a partner of theirs. Um, but what I think one of the reasons we're asking you for your areas of opportunity is we want to be able to continue to provide additional resources for you through the Mobile Health Map and the Mobile Health Care Association. But also, I think it's always just reassuring, I guess, to know that you are not in this alone, that there are programs all over this country and in the United States, in Canada and Mexico that are having similar challenges. And that's why we bring you all together to not only learn from each other, but to support each other. And I find that this is a community that really wants to share their ideas. Thank all those who shared today. And so we will take these informations that you are looking at. I did see someone in the chat asking about having a mobile mammography van that was traveling around to different FQHCs. I just was talking with a dental with in North Carolina. There's a shared dental unit that's traveling around to FQHCs. And so I think that as we look at how we can expand mobile health and understanding that it's expensive to get started, and you need to have a sustainability plan. That some of these shared ideas are ones that we can all be thinking about as a possibility to expand services in your area or to expand them demographically as well. Um, so we have a few more minutes before we kind of wrap up, but I just wanted to ask if anyone had, I'm going to go wild here and say, does anybody have something that they would really like to share or an opportunity that they are seeing in this space? You can raise your hand in the chat feature. I do appreciate everybody being so engaged in the chat. All right, with nobody having a burning thing that they'd like. Oh, Stuart?
Yeah, I hate dead air like anybody, but I was just going to say I am the executive director of the Lowenstein Foundation. We have the privilege of being associated with some of the heroes on this call in helping mobile healthcare get to scale. But I just wanted to start by congratulating all of you, those who brought this call together, but everyone who's doing this harsh work on the front lines, and many of you who did so during COVID as well. So you're re-upping in a way. I think one of the things that I hear, or I'm hearing, is just this incredible resilience that you possess that was alluded to by Nancy earlier. I think also an awareness of how these meetings not just share good ideas, but keep your spirits up. This is a gathering storm. You have challenges already. There are more challenges brewing, but in that there will be opportunities. And COVID was a horrible experience for many, many people, but it was also an opportunity for mobile healthcare to shine, as I think it will again, even though, as was pointed out earlier, we got a lot of questions we're not exactly sure. But I think partnerships was mentioned. That's brilliant. That's innovative. I see it every day when I check my Google alerts for mobile healthcare, and I see partnerships with schools of nursing and for docs and DOs and PAs. I see health systems, believe it or not, and insurers. Rural hospitals are going to be killed with this Medicaid change that's underway. But there are places that I hope serve as refuges, refuges like community foundations. Several of you have mentioned, like in Jefferson County, Missouri, community foundations can be really useful. So as tough as it is, and I don't possess a pair of rose-colored glasses, I think there will still be some places you can go. And if nothing else, it's so wonderful that you have this amazing community to be part of. And thank you for letting us be part of it. I'll end with just 3 words: driving health forward. That's what you're doing. There's a lot of people who want to put it in reverse, right? Whether it's Obamacare or Medicaid, or anything else you can think of, driving health forward, when you put those 3 words together and you go .org, you're going to see a campaign that all of you can be part of, which will do more of the same, sharing resources, sharing ideas, and also reminding you you're not alone in this. So thank you for including us on this.
Thank you, Stuart. And we're going to have a slide about driving health forward coming up here in a second. But thank you to you and your vision and the continued support of the Leanne Lowenstein Foundation. James, I see your hand up. Do you want to unmute? All right, seems like James is having some technical difficulties, so I will pass it. There's a question in the chat: are pharmacy services difficult to obtain? And so I'm not sure. Ruth, if you want to unmute yourself and explain a little bit more about what your question is.
I just in knowing that every state has different laws regarding pharmaceuticals, I don't know if that has been a continuous problem for getting prescription medications to the patients that you're seeing on medical visits, or in any particular state where that is an issue. That's something that we could look at to see how Direct Relief can assist, or also in other organizations that might be able to assist with that, to try to do the complete picture. I love the ideas of collaborating with all the different organizations, with having a mobile dental and a mobile mammogram and a mobile health and mental health probably all together. And I'm just trying to pull in the other aspects of it, and pharmacy hasn't come up. So I was just curious.
Well, thank you, Ruth. And if anyone in the chat has some barriers with pharmacy that you'd like to share, we can get that to Ruth. Ruth is a wonderful partner from Direct Relief, but also a licensed pharmacist. So I think she has that hat on in many locations. So Dr. Oriel, I'd like to send it back to you with some resources that I know you want to share with the group.
Absolutely. Well, first of all, I want to thank the whole group for just this amazing, optimistic, creative, helpful, sharing of ideas. Elizabeth, I want to thank you. You are brilliant. I mean, to be able to read the chat and respond to it at the same time, I mean, my hat's off to you. Stuart, what can I say? You made all this possible. Thank you so much. So I want to give all of you something in return. So I have 4 resources to share with you. One is an invitation to submit a paper for a special edition on the advances in trends in mobile healthcare. Molly Williams and I are co-editing this special edition, and we're looking for people to submit original research on planning, outcomes, challenges, advances in mobile healthcare. And the goal of this special issue is to strengthen the evidence base for our sector and increase the understanding of our innovative model of healthcare. So for more information, we will send, Elizabeth, we will be sending information, right? So for more, if you Google special issue advances in and trends in mobile healthcare, you will get there, but we will send you the actual information. I also want to, another resource, I've got 4 of them all together, is Driving Health Forward, which you heard about already, but I'm going to say it again. I want you to be aware that there is a campaign that is underway, and this campaign is called Driving Health Forward, as you heard, and its goal is to exponentially expand access to healthcare via mobile clinics. The campaign, funded by the Leanne Lowenstein Foundation, is working to identify and address the barriers to growth and sustainability that we mobile healthcare providers are experiencing. We are stronger together, and this campaign is one effort to bring our knowledge and power together so we can identify and make the changes that are needed to help our work thrive. So to learn more, go to Driving Health Forward. Another resource is to invite you all to join Mobile Health. We'll come back to that, to join Mobile Health Map. Mobile Health Map is a free online platform where you can anonymously share your impact data, and then together we tell a story about our collective impact. or you through your own private dashboard can measure and share the impact of your organization. The dashboard is a very powerful tool for convincing funders of your value. And if you're not on the map, please join. It's free, and that's mobilehealthmap.org. I also want to point out the fourth resource that our co-host here, Elizabeth, will tell, and she's going to tell you more details. You can see them up here now, that the annual Mobile Healthcare Association Conference is this September. And I want you all to come so we can continue this conversation. But lastly, I actually want to give you a gift. Sometimes we need new eyes to see what has been there all along. And so I want to read to you observations from a medical student who spent a month on the family van. And these are her words. Through my time on the van, I've come to deeply appreciate the power of the therapeutic presence. A presence alone could hold meaning. It is about being fully engaged, not just with clinical knowledge, but with attention and care. I've also come to understand that a therapeutic presence is not necessarily an individual, as spaces hold meaning too. The van is a space that has a personality of its own, one that is safe, comforting, welcoming, and loyal. It holds on to the many stories, struggles, and identities of those who pass through. It is a space where people know they can fall back to in times of pain and grief. It is physically embedded within the neighborhoods it serves, and by showing up consistently in those communities, it builds a sense of reliability and trust over time. Patients know where it will be and when, and in this way, the van is not just a setting for care, but a therapeutic agent in its own right. It is a vessel for healing, empowerment, and connection. The van is not just a setting where care happens. It is part of the care. And with that, I thank you and turn you back to Elizabeth.
Dr. Oriole, you always know what to say at the right time. And I think in this time of uncertainty, for a lot of our programs and a lot of us individuals as well in this country, I thank you for sharing that uplifting message and just kind of reframing that really this is all about the care we provide and that health equity is something that everyone deserves, and so proud to be part of a community that sees that and is trying to make that a reality. So thank you so very much. I also want to thank the Mobile Health Map team and my team at Mobile Healthcare Association who pulled this off as an idea 2 weeks ago that we should come together. And here we are, and all of you that have shown up. I did want to give one more plug for our conference. Registration is open, and I think coming together at this time is just so very important. If you want to go back a slide real quick, but I also want to tell you today is the deadline to put in a grant for our Jerry McClarty connectivity package. It's the hardware, it's the software, it's installation. It is the shortest grant application you will ever see in your life. And so I'd recommend that you, as we all have funding issues, but a lot of people have connectivity issues, I'd recommend this. But early bird registration is open till July 10th, and we hope to see you there. And this will not be the last time we'll be together. We'd like to bring you all together again to continue to learn from each other, to come up with creative solutions together. But please be in touch, and we will send a follow-up email with all the resources that Dr. Oriole mentioned. And we hope to see you all in Louisville in September.